Chronic low back pain is one of the most prevalent issues that Americans face, but many of the ways of trying to address low back pain are either extremely invasive or can actually leave the patients worse. On today's episode of the Exercise is Health podcast, Julie and I sit down with Dr. Ankur Dave to discuss his new innovative way of helping people address low back pain without surgery and the use of opioids. We're going to cue the intro song and then we're going to dive right into this conversation. Welcome to the Exercise is Health podcast, where we're talking about exercise, health, and the interconnectedness of the two. We are your hosts, Charlie
and Julie,
and we will be coming to you every single week from our studio, Muscle Activation Schaumburg. Hey, what's going on, exercisers? This is Charlie. Before we dive into this week's episode, I want to ask you if you've ever thought to yourself, wow, the information on the Exercise is Health podcast is so great, but how do I go about implementing it? This is a question that we have been hearing time and again from so many of you. And because of that, we have created something that you are going to absolutely love. And that is the One Workout Away Challenge. See, you are just one workout away from feeling stronger, from functioning better, and from living healthier. And over the course of 28 days, Julie and I want to teach you how. To learn more about the next One Workout Away Challenge and get signed up, go to owa.matschaumburg.com. And without further ado, let's get into this week's episode. Hey, welcome back, exercisers, to the Exercise is Health podcast. We are your hosts, Charlie
and Julie,
and we're coming to you from our studio, Muscle Activation Schaumburg, here in Schaumburg, Illinois, where we believe that your health is your most valuable asset, and the single best thing that you can do to both boost and protect this asset is exercise. Specifically, exercise is geared towards building the health and function of your muscles. Now, so many of you have taken the time to leave us a rating and review on Apple Podcasts, and we are extremely grateful for this. So we want to take a moment right now to highlight a recent review that we received.
This 5-star review says, "Thank you. Wow, so happy I found this podcast. Julie and Charlie have great tips and examples where I find myself really relating. They are well thought out and deliver relative and helpful content. Thank you for your commitment to us, your podcast community." Thank you so much for that 5-star review. It means so much to us. If you're listening to this now, please take a moment to go to Apple Podcasts, leave us that rating and review, because we love to hear from you. We love the feedback we get from you, and you never know, you might hear your review on the podcast next time.
So, Julie.
Yes.
How many people have you worked with in the past that have had low back pain or experienced low back pain at some point, percentage-wise?
I would say at least 75%.
At least 75%, right? So, I mean, low back pain is extremely prevalent, and I would agree with that. Like across the board, people are experiencing issues with their low back or somewhere along their spine. Well, most of the ways of trying to address low back pain end up being surgically invasive or medically invasive from, taking opioids or something like that. But did you know there's actually a way that you can go about helping to address low back pain that doesn't involve either? In fact, this is exactly what we discussed with our guest on the Exercise is Health podcast, Dr. Ankur Dave. Now, you may remember Dr. Dave from our episode that we did with him 3 years ago, back in 2019, where he discussed how to address chronic pain without the use of opioids. And we are so excited to welcome Dr. Dave back. Dr. Dave is a Harvard-trained double board-certified pain management physician and anesthesiologist. He currently serves as a medical director of pain management with Amita Health. His area of expertise is helping patients implement healthy lifestyles to their current medical treatment and provide solutions to avoid more invasive options. He also works with regional public health organizations to help combat the opioid epidemic. Well, Dr. Dave, thank you so much for joining us and welcome to our show.
Thanks for having me.
Yeah, this is your second time on our show. You are our first repeat guest. So we're really excited about this. Very honored that you would give us more of your time to really talk about pain management, which is something that you specialize in, and specifically low back pain. So that's kind of where I want to start is low back pain seems to be pretty prevalent, but really how prevalent is it? And even if we take a step back, like what is low back pain? Is it just kind of a general feeling of tightness or kind of what's going on there?
Yeah, these are great questions. Great way to get started. Low back pain is pain that, is pretty well localized from like the bottom of the shoulder blade down to the tailbone. For most people, it kind of presents itself as aching, maybe some stiffness, whether it's first thing in the morning or by the end of the day. And, every now and then you'll get patients who have something called sciatica. A lot of us have heard of that. That's when there's a pinched nerve. It'll send pain, burning, numbness, tingling down the leg. That's kind of what most people experience with low back pain. We define low back pain as acute pain versus chronic pain.
Okay.
So acute pain is something that a lot of us have kind of felt, right? Especially now if we're shoveling the snow. It's pain that kind of happens when you overexert yourself, like a muscle strain or something. And if you baby it, if you take care of it, then over a week or so, it kind of goes away. Chronic pain is pain that just sticks around, so it's pain that'll stay for longer than 3 months. And it can present itself as back pain that's there all the time. Maybe it's just in the background, or it comes as episodes. So, you throw your back out. A lot of people might say that.
And so then when it comes to low back pain, I mean, it seems like a lot of people that at least we interact with at our studio have had some episode of back pain within their recent history. Is it just the people that we're seeing, or is it, kind of a very, very common thing, especially in the US?
It's very common. A lot of us don't know that chronic pain itself is actually an epidemic right now. And it's been going on for many years. You might be surprised to know that 25% of all Americans have experienced some form of low back pain in the past 3 months.
Whoa.
Yeah. And even taking that further back, 80% of all Americans are going to have some form of back pain in their lives. So 4 of 5 people that you meet on the street, they're going to have some episode of back pain that's going to be a problem for them.
That's crazy.
It's crazy. And what we know is that the more severe and the longer that people have back pain, the tougher it is to treat. And that's why managing chronic pain actually costs more healthcare dollars than heart attacks, strokes, diabetes combined.
Wow, that's insane. Yeah, I never would have guessed that, because you just think about, okay, like, you're in some discomfort, or maybe you're in more severe pain or whatever, but the actual dollars associated with it, that's mind blowing. What are some of the challenges that people run into when they're trying to address their low back pain? Like, why does it continue to stick around if, so many people are experiencing it?
The biggest challenge that I've seen in my practice is being proactive about low back pain. So the best time to treat low back pain is actually before it begins. And that's why consistent exercise and healthy lifestyle, like you promote on Exercise is Health, is so important. But for 80% of Americans who are going to have back pain at some point, the next best thing is to really get started when their back pain is more of like an ache or a nuisance, and not wait it out. Yeah, I get it. Most of us have a lot of things going on, and we might put our spine health on the back burner. We, work, family. We'll think, we'll get to that later. But the longer we have low back pain, the tougher it gets to treat, and the more frustrated we get by it. So we end up in this kind of vicious cycle where we start changing our lifestyle, whether it be physically or socially, because of the pain. And then that gets us down. And, not only do our muscles then weaken, but our mood also changes. And what we know is back pain and mood go hand in hand. In fact, 80% of people who have low back pain also have some form of depression too.
Really?
Right. Wow. So, that the back pain itself, if you just put it in a silo, can end up being manageable, but the impacts of it, the frustration, the isolation, those things might actually make the feeling of back pain intolerable.
Wow. Yeah. It's so interesting you bring that up, because one thing that I know that I've communicated a lot with, clients and prospective clients and stuff, is just how much their pain or whatever they're in when they first start coming in, how that affects like their sleep. Right. And I mean, if somebody's not sleeping well, then that just adds to the dangerous spiral, in addition to the mood changes that you're talking about. And, the changes in their lifestyle of like being less likely to exercise, being less likely to do other health promoting things. And so that's just crazy. Like you're saying, just how vicious of a cycle it becomes, when initially it may not start off that bad. Initially, like you're saying, people may just be like, well, I'm just going to kind of wait it out. I'm just going to kind of see if this resolves on its own, as opposed to taking that proactive approach. So in addition to exercise, in addition to, other healthy lifestyle things that fuel that proactive approach, I know one thing that is changing a lot these days as far as like how people take care of their health is technology. Do you have like top of mind kind of any opportunities or things where people can use technology to actually help them either like track or identify or manage their low back pain?
That's a great question. I think technology has taken a really big leap forward with COVID changing how we're working, at home versus in the office and even performing everyday activities. We don't understand the true impacts of it, right? Like a lot of my patients, they're not working from home. So they're not in the office. They're not interacting with coworkers, whether they like them or not. And they're not taking those steps up and down the stairs to and from the parking lot, things like that. And all of it just kind of adds up. So digital technology, even pre-pandemic, has been really good about tracking, with Fitbit. You could track someone's step, or Apple Health or Apple Watch. You can, see how your heart rate's doing and things like that. So it's really flooded the market. But one thing that I have patients tell me is like, hey, I see all this technology out there, but I don't really know which one I'm supposed to do. Like if I already have low back pain and I go on YouTube and I just put exercises, I might end up making my pain worse.
Right.
And a lot of these videos and technologies, they don't take low back pain and its impacts, as we just talked about, into account. So, that's actually what led me to create an app called Pain Navigator.
Oh, awesome.
Yeah. So Pain Navigator is actually created by a group of us who are trained and manage people who have low back pain. So it brings everything that all these medical organizations like the CDC, AMA, what we all recommend for first line low back pain therapy, we bring it to your fingertips. So
cool.
So when a user signs up, they get access to 4 key tenets or 4 key therapies. One is medical education, so going into more depth about low back pain. The second is wellness strategies, so learning how to manage the pain with pacing activities, improving your sleep, and the impacts that might have on your low back pain, nutrition, anti-inflammatory diets, things like that. And then the third and fourth component are more physical based, so exercises geared for people who have low back pain, as well as yoga and mindfulness, because we also know that if we're able to relax those muscles and stretch those muscles out, that can have a long-term impact. And we make this easy for people, so you go at your own pace. We say about 30 minutes a day, 3 to 5 days a week. And patients, our users that are going through it, we've seen a 50% reduction in pain.
Really? That's astounding. That's really, really cool. Over what kind of time frame?
So it can, you go at your own pace, and we have a wellness coach that'll touch base with you once or twice a week and see, what's the best way for you to do this program. But for most people, it takes about 6 to 8 weeks. So if any one of your listeners has had low back pain before, they'll know that usually if they go to the doctor and the doctor gives them physical therapy, that's also about a 6 to 8 week program. So we try to mimic that and either complement physical therapy or say, hey, try this first because it is more convenient for your lifestyle.
Totally. Well, and what I love about that is, like you were mentioning earlier, how chronic low back pain is kind of that 3-month mark or beyond. And the longer the low back pain has been there, the more difficult it becomes. So, with the access to this app, if somebody is starting to feel that twinge, if somebody's starting to feel that ache or whatever, they don't have to wait until, longer and longer until they can do something about it. Like you're saying, it's all at the fingertips. They can just start in on this app, start, doing the right things that need to be done to help kind of calm things down, hopefully. And then, within maybe the 6 to 8 week time, or maybe if they jump on sooner, maybe even sooner than that, then they're not waiting until it's, into that chronic low back pain and it gets more and more difficult to address. That's really cool.
Yeah, that's, 100% right on. What we've seen a lot of people with low back pain, when it first kind of starts and it becomes an issue, they say, okay, well, maybe I'll talk to the doctor, maybe I'll go to a chiropractor or something like that. But first, let me try doing my own exercise. Unfortunately, either they're going to go on YouTube and they're going to look up some exercises, or they're going to do what they were doing back in the past. Right. Like, maybe if you're in your mid 40s, mid 50s, and, when you're in your 20s, you're doing some weightlifting. So you're going to say, you know what, maybe I have to go back to that. but now you have low back pain. So a lot of those people end up flaring their back because they're doing what the exercises they were supposed to do in their 20s.
Yeah.
So this is really quick, like, hey, I don't have the time, or I don't really know what I'm supposed to do. Just get onto Pain Navigator, get started, and you'll see results.
That's awesome. That's super cool. So one thing that kind of caught me off guard that you were saying is that you include kind of low back pain education. Talk to me about that. Like what kind of content is there? And then I'll give a follow-up kind of once we talk about that. So let's start with kind of like what kind of content is in this low back pain kind of education module?
Yeah. So, if you look up low back pain on the internet, there's, millions upon millions of articles.
Sure.
So, what I found and the way I practice is I like having my patients understand where their back pain is coming from. So we talk about acute versus chronic pain. We talk about different causes of low back pain, whether it be muscular in origin, whether it be arthritis, whether it be a pinched nerve, things like that. And then we also talk about those other impacts that pain can have. So, we know that sleep, for example, you talk to your clients about that. Sleep will ramp up something called the ascending pathway, which is the pathway that sends signals up from the low back to the brain saying, hey, I'm in pain. So a lack of sleep is going to make that pathway worse, and the pain gets worse.
Interesting.
Where if you get better sleep, you bring that descending pathway in, which is the opposite of the ascending. And that tells your back and your brain, hey, I can manage with this. Like, I feel better.
Interesting. That's super interesting. I read a study once about researchers who were looking at the effect of sleep on the perception of pain. And they had people, I believe it was their foot, stick their foot into ice water and see how long they could keep it in there. And then they would sleep deprive them. And then they would do the same thing. And like across the board, when people got less sleep, they were less tolerant to the pain they were experiencing, even though objectively it was the exact same stimulus. So that's really interesting to kind of hear how that happens. And, again, just bringing back that vicious cycle that we were talking about earlier, if your back's bugging you, you may not get as great of sleep, which means your back's going to feel like it's bugging you more, which means you're not going to get as great of sleep. And so again, it's just this downward spiral. So having that education and then the way to kind of go about being proactive about it, that's huge. That's huge. Have you found that the education piece has been really helpful for the people that are using Pain Navigator, or are they more like, well, I don't really care about like the why. I just want to know like what to do and get it done.
So far, people have been really receptive to the medical education part. I'm a little biased because that's my part.
Sure.
But, I think what happens is a lot of people want to understand what's going on, right? And either you feel inundated by what you read online and trying to figure out where you fall into that, or you're going to the doctor and the doctor might explain it the way you like it or not, but there's a lot of other things that happen during that appointment. And I try to sit down with my patients and have a really lengthy conversation, but I know that there's a lot of other things going on in the mind. So having something that someone can rewatch, someone can kind of understand it at home in the comfort, of their couch is, I think, a really useful tool, especially when it plays a role with everything else, right? So holistic care is really what we preach at Pain Navigator. So understanding how the medical education part fits in with the wellness part, how it fits in with the exercise part or the mindfulness part. I think that's the other component that people really appreciate.
That really makes sense to me. I think that's exactly what we see with the clients that we serve as well. As much as, the fitness industry just wants to like ram workouts down people's throats and just be like, just do this. We find that more times than not, people want to have an active understanding in why they're doing what they're doing. And then not only does that help the buy-in, but it helps them like really believe that they can actually do it and that it's something that they are going to be able to keep up. And the great thing about the content that you're putting out on the Pain Navigator app is it allows people almost a shortcut to just kind of cut through all the nonsense and all the other noise that they may be, finding online about low back pain. Just be like, okay, here's the source, here's the expert. Let's just hear what they have to say. And they don't have to do all the sifting through. So I can see that being a super useful thing for your users.
Absolutely. One thing that you probably know really well, but a lot of users should understand is that with low back pain and a lot of medical conditions, there's this short-term and long-term impact, right? And, we're all looking for that fix to say, hey, I want to just treat this and move on. But that's really not how things work. Like, look at fad diets, right? You do a fad diet for a month or 2 months, you might lose that weight for the wedding. But if you don't keep it up, which a lot of fad diets you can't, you're going to end up putting that weight back on. So, what we want at Pain Navigator is we want your pain to get better over this period that you're using it, but we also want to give you tools that you can implement in your everyday life. Make these good habit changes that'll keep you going 2 years, 4 years, 6 years down the line. And one thing I'll say is, Pain Navigator was started, we actually had an in-person program that did the same thing. And it was really helpful. So we saw about 30 to 50% pain reduction, but that lasted for more than 2 years.
Wow.
So, in this 6 to 8 week program, we were able to kind of help people change these habits that stuck with them long term. The issue is just that it's just not convenient for someone to go in, 1 hour at a time, 3 days a week. In the middle of a work week. So we digitized, and we're hopefully going to see the same successes that we saw with that in-person camp with Pain Navigator.
That's awesome. I love it. I love it. So if somebody's listening right now and they are experiencing low back pain, or they've experienced it in the past and they don't want it to come back, what are some things that you recommend them doing in order to improve their situation or make sure that they stay feeling well?
Well, I think the most important thing is staying active, and also doing that self-dive about like, hey, how is pain impacting me socially, physically, psychologically, or mentally? And trying to figure out where you are in that spectrum. Are you looking to self-manage? Do you think that that's where you are right now? Or do you need to see someone more specialized to figure out more of a medical or therapeutic game plan?
Sure.
For your users who are interested in Pain Navigator, it's really easy to sign up. You just go to www.painnavigator.io. Cool. And you sign up, and we actually have a special deal for your listeners.
Oh, sweet.
If you use the access code WELCOME21,
nice.
You'll get the whole app for free. In fact, we'll actually pay you $80 to do the app.
Really? Right on.
Because we want to incentivize good behavior and good habit, I should say. So, you go through the whole app, you'll get $80.
That's awesome.
Yeah. And you even get a wellness coach that'll touch base with you and kind of guide you through the whole process. So, once you sign up, the coach calls you within a couple of days, and, it's kind of a win-win there.
That's it. That's a huge win-win. Okay. So it's Pain Navigator app.io.
No, it's www.painnavigator.io.
Okay. No app, just IO. All right, great.
And the access code is WELCOME21.
WELCOME21. All right, sweet. We'll make sure that all of that is in the show notes. That's super, super generous. Thank you so much.
Yeah, no problem. You said at the beginning that I'm the first time interview coming back.
Yes, exactly.
So I had to come with something for you.
I love it. I love it. Right on. Well, Dr. Dave, thank you so much for sharing your time and your expertise. Is there anything that I haven't asked you that we should have asked you about low back pain, about Pain Navigator, or what people can do to help themselves with your app?
I think we touched on a lot of great stuff. You've done such a great job with Exercise is Health, kind of laying this foundation for a healthy lifestyle overall. And I truly think that, Pain Navigator is, stepping on that foundation for the people who want a healthy lifestyle, but have to have some low back pain too. So it's great to come on here and really, collaborate and work together to help a lot of users and listeners.
That's awesome. Dr. Dave, thank you so much. Where can our listeners find out more about you? Is your contact information on the Pain Navigator website? Or, are you working with people in person in addition to virtually through Pain Navigator?
Great question. So I'm at Amita Health at Alexian Brothers in Elk Grove. So awesome. For in-person appointments, you can, the phone number is 847-981-3630. And if you are interested in Pain Navigator, even like it's www.painnavigator.io. And if you want more information just about the whole holistic care for low back pain and what we're about, you could check us out at www.navigatemypain.com. That's all one word.
Cool. Very cool. All that will be in the show notes. Dr. Dave, thank you so much for coming on, for sharing your expertise. This was fantastic. Your Pain Navigator app is such a value add across the board. So thank you for putting the time, the effort, and the energy into making it happen. Really appreciate it.
Thanks a lot, Charlie.
All right, how cool was that? Look, if you are experiencing low back pain, if you know of somebody who's experiencing low back pain, you definitely need to refer them to the Pain Navigator app. Remember, all you have to do to get registered for free is go to painnavigator.io, and that will get you set up on the Pain Navigator app. And as Dr. Dave said, not only is it free, but they'll actually pay you to use it. So go to painnavigator.io, check it out, get started with this, so Dr. Dave and his team can start helping you with your low back pain. So who do you know that needs to hear this episode? Who do you know that is experiencing low back pain, has tried so many different options, all with results that weren't appealing to them? Share this episode with them so they can learn of a different approach to approaching low back pain through the use of technology, and that can be done conveniently on their own time. And while you're online, head on over to Apple Podcasts and leave us a rating and review. It helps people find this episode when they're looking for information on exercise and when they're looking for information on health. So if you enjoyed this conversation today, let us know by leaving us that 5-star rating and review. Well, thanks so much for tuning in. We always appreciate it. Have a fantastic week, and we'll talk with you all next week. So what did you think about that episode? Did you find the information useful? If you would like some more in-depth guidance on applying this kind of information to your own workouts, make sure to sign up for the upcoming One Workout Away Challenge. You can get registered by going to owa.matschaumburg.com. This podcast is for information purposes only. The statements and views on this podcast are not medical advice. This podcast, including Julie and Charlie Gates, disclaim responsibility for any possible adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements or advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to herein. If you think you have a medical issue, consult a licensed physician.